I'm Abhay Gupta from Gupta Plastic Surgery. I'm a board-certified plastic surgeon here in San Diego. And this is another edition of our Question of the Month feature on our website, guptaplasticsurgery.com, where visitors get to submit their questions in plastic surgery, stuff they were wondering about, and we get to pick the more popular one of the month and answer any questions about plastic surgery, dispel any myths there might be, bring people up to date on the latest technologies in plastic surgery. So this month's question is about cellulite. A lot of our readers want to know how to treat what is cellulite, how can we treat cellulite? Is there a good way to do that? The cellulite refers to the irregular surface of the skin, the dimpling, the puckering, the orange peel type of appearance of skin that can happen, particularly in the buttocks or the back of the thigh in women after puberty and most adult females. There certainly is a genetic predisposition to getting it. If your mother unfortunately had it, then often you're going to develop the same kind of irregularity in the skin surface. And to date, there's not been any very good treatment for cellulite because of the multiple characteristics that happen within the skin. And what happens in cellulite, there's three different things that happen in cellulite. If you look at the picture close up of your skin is composed of a layer of skin and then a bunch of subcutaneous fat or fat underneath the skin, and then the muscle layer. And there's several connections between the skin and the muscle layer that holds your skin in place so that your skin doesn't just sag off your body when you stand up. Now those connections to the muscle layer are important, but also unfortunately are a significant cause of problems when you develop cellulite. And what happens is you can start to get buildup of fat in the body as you age, as your hormone levels change, with pregnancy, with weight gain, you're going to develop more fat deposition in the skin. Now that fat deposition can start to develop more closer towards the skin surface. As this pocket that's produced by the bands gets full, more of the fat's going to bulge up towards the skin surface, and that's what causes the little outpouchings of fat underneath the skin. As that happens, these vertical bands tend to tighten because of excess attention placed on them, and when they tighten, they pull down on the skin and you get the dimpling. So you get this alternating dimpling and bulging that looks like an orange peel. And finally what happens is as the skin ages, as it gets stretched, it loses elasticity. So the actual tightness of the skin relaxes and loosens, and you get loose, wrinkly, dimply skin on the surface. So those three factors are what lead to cellulite. Now, until recently there was not any very good treatment of cellulite, but now with new laser technology we certainly have a very new and exciting way to treat this for long-term results. And that's with the cellulase laser, which is the first FDA-approved treatment of cellulite, and it's minimally invasive and is performed with a laser under local anesthesia in the office setting. For any particular area of cellulite, it takes about 40 minutes or so to treat, and again, done under local anesthesia, patients can have the procedure done and drive themselves home the same day. And so how is that done? Well, what we do is with laser technology, similar to a laser liposuction, it's done through a very, very tiny incision, about 1 millimeter, 2 millimeter type of incision, and we pass a laser cannula. This looks like a laser probe. It's like very tiny, about 1 millimeter at the tip, and this is a long coil that we uncoil it. It hooks into the laser machine, which generates the energy. And what we do with the laser probe is we put it underneath the skin surface, and we treat those three causes of the cellulite. With the laser, we first melt the fat, the large amount of accumulated fat in that compartment. We melt it so it shrinks, and as it liquefies, it therefore releases that bulging in the skin. The second thing we do with the laser is we go and we break up those bands, those vertical tight bands. The laser disrupts them, breaks them apart. So we lose the dimpling of the skin, the puckering of the skin, and it's a much more even tone. And then finally what we do with the laser is we take the laser and direct it up towards the skin surface around the underneath of the skin, and we heat up the skin. And when you heat up the skin, you heat up the collagen in the skin, which is the protein that's the elastic portion of the skin. If you want to think an analogy, for example, if you put an egg in a frying pan, the protein in the egg will contract as you put heat on it. Very similar to the skin, we can heat the skin and cause it to tighten. And what that does is it fixes that irregular skin surface that's the last component of the cellulite. So for example, if you look at the before and after picture treatment here. So before, again, three components, the fat, the bands, and the skin surface. After we've treated with the laser's gone and broken up those vertical bands of fat so they're no longer pulling on the skin. It's melted all the fat that's in those compartments, so there's no longer the bulging. And then with the heating of the skin surface, making it more elastic, it evens out the tone, so it's no longer bulging in and out, but it makes it much more flatter and smoother. And therefore, we can treat cellulite very successfully using a laser procedure. And the overall procedure, again, takes about 40 minutes or so to an hour here in the office under local anesthesia. And patients are recovered by the next day. They'll have swelling and bruising for a couple of weeks, but the results are pretty impressive, and you can see them after a few weeks. So hopefully that answers your question about cellulite and the exciting new ways of treating it. I look forward to reading new question submissions on the website and picking the one for next month's question of the month, and we'll see you then. Thank you very much.